Hi, folks. Welcome to our second Ask Me Anything from Timeline. And the topic of the day is longevity and health. And to my left here, you've got Dr. Anurag Singh,
Hello.
who I'll introduce in just a second. I see we already have quite a few people on, and also a lot of great questions that came in ahead of time, and also some great questions already on the live chat here. So I wanted to thank everyone for taking the time out of your busy schedules to join this session. Hopefully you'll enjoy it and learn something helpful for your health. A couple of quick logistical things. So you've got a live chat on your right hand side. So feel free to ask any questions as we go through the session. We'll try to answer as many of these as we can. If we don't get to them today, we'll take note and we can take them in a follow-up session, or we can also get back to you via email. So please do let us know. Of course, we've got a fun disclaimer that I need to give out here. I just want to remind everyone that while Dr. Singh is a phenomenal medical doctor, he is not my doctor nor your doctor. This session is intended purely for educational purposes only. So please make sure that you do consult with your personal physician on any health matters. So let's get started. So let me just introduce Dr. Anurag Singh. So Dr. Singh is a medical doctor. He's an MD, but also a PhD, and he's been doing research for now over 15 years, and is truly, in my opinion, one of the leading experts worldwide on this emerging topic of longevity and geroscience. So I'm very excited to have him with us here today.
Thanks, Rodrigo.
Great. So before we get into to the questions, I wanted to ask you a question. And my question to you is, why would, after all the hard work of going through medical school, we all hear the grind of medical school, how hard it is, how long it takes. After all that hard work, why then go do even more academic work, go do a PhD? Yeah.
Well, a number of reasons. One, a lot of the medical education that we have today is actually only preparing modern physicians to only tackle the symptoms of disease, right? So what we are seeing actually is patients are going to their doctors with joint pain or problems in mobility, and that's when you're actually seeing when the actual chronic condition has set in, and that's one of the reasons. And the second reason, at least for me, was that there was not much research happening. When we started looking at, when in my training days, I was exposed to medical research, I felt like this was one of the areas of nutrition which was really under research. Like, not a lot of people were doing high caliber science. There's a lot of blends of vitamins and probiotics without much clinical evidence. And so I thought that was the other key. And then, really, that's the calling. As a doctor, I was seeing a few patients a day, treating them with certain similar chronic ailments, and if you research on something that is breakthrough discovery that goes into sort of commercial products and consumer health products that basically bring a difference to hundreds and thousands of people, I think that's why I decided to embrace this calling.
Okay, super. Well, hopefully mitochondrial health and MitoPure is a discovery that can have that magnitude of impact. So let's jump into the questions.
Sure.
So the first one I've got for you here is around a topic that's trending a lot recently, which is this concept of zombie cells.
Okay.
And the question is, can MitoPure eliminate our zombie cells or hit other hallmarks of aging other than just mitochondria?
Sure, that's a great question. Well, let's begin by explaining what zombie cells are, right? So zombie cells essentially are cells that have lost their capacity to divide, basically, or grow. So they, in let's say the nerdy language, we call them senescent cells. Zombie cells is just a very trending marketing name. So these are cells that basically are taking a lot of resources. They're taking a lot of energy. They're producing a lot of inflammatory mediators. So they're not doing anything. And as we age, we're basically accumulating a lot of these zombie cells in every organ. And so they've lost their self-renewal capacity, which means now you've lost these, what we call stem cells, and the stemness in your cells. And so, yes, urolithin A has been mostly studied as a mitophagy activator and having these great impacts on mitochondrial health, but it acts on different hallmarks of aging. It acts on the cellular senescence pathway. In fact, there's a very exciting paper that came out at the end of last year in Nature Aging that showed that urolithin A was boosting the stem cell capacity of a lot of these hematopoietic stem cells. And so it does hit these senescence and can remove the zombie cells, and then it can trigger more stemness in the cells, or more youthfulness in the cellular population. And inflammation is now, so it used to be 9 key hallmarks of aging. Now there are 12 of them that are described, and chronic inflammation is one of the key ones. And what we're seeing MitoPure really do is that it hits not only corrects mitochondrial dysfunction, but it also is an anti-inflammatory. So it kind of dampens the inflammation, this sort of inflammaging that we call that happens with aging.
Mm-hmm. Okay, super. So the next one I have here is, does MitoPure affect any cell in the body or only muscle cells?
It's another great question. So yes, a lot of research that we have done today is primarily focused on mobility and muscle biology, and primarily because the muscle is one of the key longevity organs. If you're not moving well, you're going to lose your cognitive capacity. You're going to have poor immune health. So what we see actually is, and we started that because this is how we first, working with really the top scientists in the mitochondrial field, we started seeing effects on endurance and muscle strength, and that's what we have translated in a number of clinical randomized trials. Now the interest has really peaked in the academic world, and so what we are seeing, and we're seeing about 100 papers published every year, is that when you take orally urolithin A, it's going to hit almost every cell type that has mitochondria, right? Except a blood cell that has no mitochondria. So immune cells will get hit, your skin cells will get hit, your neurons will get hit, your cardiac cells will get hit, even joints. And we've done research almost in every spectrum to see that, it's reaching different organs, and we're seeing these great effects across all tissue types, especially the ones that have a lot abundance in mitochondria.
So that's a good build to my next question, which is, if I'm already taking MitoPure orally, I'm taking my 2 pills a day or my 4 pills a day, why would I need to apply the topical product on my skin?
Yeah.
If it's hitting the body systemically, it's hitting all these cells, including skin cells, I'm assuming. Why would I then need to apply it topically?
And again, I think it's a relevant question to ask. Why did we go out and build these, develop these topical products that also are improving let's say, the cellular health of our skin cells when applied topically? So back to what I said, when you're taking it orally, you absorb the active compound urolithin A gets absorbed and gets diffused into different organs and different tissues. So it's not like only a few percent of the absorbed will reach the skin cell, right? So of course you're going to have some effect when you take it orally on your skin cells and on skin energy. But we thought that by applying it topically, and this is how we started looking at old skin cells to see if it would have the same effects as the muscle phenotype we were seeing, and we did, and that's how we developed that by combining beauty from within, as the trending name is, by taking oral supplementation. If you could add a direct targeted effect on the organ of interest, which is really skin, which is an organ we are seeing almost on a daily basis how our aging is happening, you would have a sort of a synergistic effect, so combined effect. Yeah.
Okay. So the next question I have for you is different, is about the microbiome. And this is a question that we touched on briefly in the first Ask Me Anything, but it's around, do we have any tests that checks if a person has the right bacteria to potentially be able to convert, for example, foods such as pomegranates that are rich in elagitannins into urolithin A, and why would they even, and if they can, why would they even need this supplement in the first place? Why not just drink pomegranate juice, for example?
Yeah, so this is a common question that I get asked all the time. So if you had the perfect microbiome, as I say, if you were really the blessed of the blessed, first of all, we in our randomized trials, we see only about 1/3 of the human population, adult population, having the right gut microbiome. And if they have the right gut microbiome, doesn't mean they're eating the right diet. So you need to be eating right. So you need to be eating the a lot of pomegranates. You need to be eating a lot of nuts and berries to get exposed to these dietary precursors. And then you need to have a chance through your microbiome to make this active molecule called urolithin A. Now, what we see is that only about 30 to 40% people can make it, and in very different levels. So a lot of people make it at very low levels that are not going to give you the health benefit. And so we have looked into the microbiome, and it's very different from somebody who does not have the capability to make urolithin A versus someone who has the capability to make urolithin A. And it's really very rich and diverse microbiome. Now, we don't have a test to really pinpoint the microbiome. A lot of companies out there have actually these tests. What we have actually invented in the last years is actually a test that can show you very accurately if you drink a glass of pomegranate juice, what your blood levels of urolithin A will be. And you can know very quickly whether you are a natural producer or not, and then you can supplement with a single dose of our MitoPure capsule, a Timeline powder, and you can see the difference. So we run studies, and we see almost a 6-fold higher response, meaning you'll have to drink 6 glasses of pomegranate juice if you are a natural converter and one of the best ones to get the same effect and same dose as in a 2 pills or in a sachet.
6 glasses of pomegranate juice every day?
Every day, and that gives you about 30 plus grams of sugar. So keep that in mind as well.
Okay. And so on the test itself, that's set up as a clinical study at the moment?
Right now, we don't commercialize the test. It's something we developed in the last years, and we have really been fine-tuning it, and it's being offered today as a clinical study. So if folks are interested in participating, we can maybe put the link to the study, and some of you can volunteer, and we can provide the test. Yeah.
So, I hear the question a lot, how do I really know if MitoPure is helping? And maybe we split this between sort of the supplement and the topical application. How do I know if it's really working? What clinical endpoints did you look at? What are maybe some of the most common positive feedback we saw both in clinical placebo-controlled setting, but also in a real life setting?
So it's a program that we have run for 10 years, Federico. So it's probably unprecedented in the longevity field to run multiple trials across multiple populations. So we've done trials in older adults, we've done trials in overweight adults, we've done now trials in almost elite Olympian athletes. And then we have run a whole gamut of trials on looking at the effects on topical as well. So in the randomized trials on the oral part, we focused on looking at cellular health markers, so markers that indicate improved mitochondrial health. So we have looked at all these through a little blood draw, and we look at what metabolites are going up and down linked to mitochondrial health. And then we've looked at very standard biomarkers such as C-reactive protein, for example. Now, this is a biomarker that indicates chronic inflammation, and we see in multiple trials that MitoPure intake for 2 to 4 months can significantly lower the concentration. Now, what we see in terms of functional endpoints is really improvement in about 10 to 12% leg muscle strength. We see in older adults after 2 months a significant increase in hand and leg endurance. So that means you just have more energy to go perform a task.
Less fatigued.
Less fatigue, exactly. And now we're seeing even better recovery. So after a bout of exercise, people, in randomized trials, better recovery. But this is one of the biggest anecdotal feedbacks I hear from our consumers, is that they're seeing these great effects after exercise and sort of recovering better and feeling more energetic, and better strength, of course, is one of the key ones.
Okay, so let's go back to a couple of questions. So do you think you mentioned that we focused to date mostly on muscle and skin, most recently in terms of clinical studies. Do you think there might be a benefit for gut, for brain, for other sort of key unmet needs as people age?
So I think what you will see
Immune
in the field is actually 3 big pillars that will come out in the next probably year or 2 years, a lot of studies on urolithin A will be focused on cognitive health. We are already seeing it. And that's important because as one of the leading, researchers around urolithin A, you go and you see a lot of other top scientists across and top universities now getting interested in brain health, for example. So we're seeing a lot of buzz around how urolithin A can impact on cognitive decline, for example. I'm a trained immunologist, so for long I've had an interest in how mitochondrial health and immune health is interlinked. So we're just wrapping a randomized trial looking at how a month of urolithin A supplementation can really impact on improved metabolic health of your immune cells. And the third is on the gut health, which is a very relevant question. When you take orally, 90% of the molecule actually gets through our gut sort of absorption, and so a lot of the effects will happen at the gut level in addition to the whole body level. And there is a lot of emerging research, and that actually from scientists in the University of Louisville, which have shown that taking chronic supplementation and, of course, experimental models has an impact on lowering inflammation in the gut and improving gut barrier, resulting in sort of impact on significantly decreasing inflammatory bowel diseases and things like this.
Mm-hmm.
So yes, there's I think gut health, brain health, and immune health will be the three big things where you'll hear a lot of research on urolithin A and, of course, in the whole mitochondrial space.
Are there any sort of upcoming clinical studies, any grants or
Yeah, so
in the US or internationally?
I mentioned this MitoImmune trial that we've just wrapped up, and this is actually a trial that we collaborated with two of the leading institutes in the world. One is the Buck Institute of Aging, and this is with the team of Professor Eric Verdun. And the second is the group in Frankfurt University that has been working on urolithin A for a long time. And so the results will be available in a few months just to really see how the immune system gets revved up after taking urolithin A or not.
So is it like a vitamin C, like an immune system booster, or?
As an immunologist and having been in the field for 20 years, if you ask me, if you look at all the trials done with vitamin C, and you say, where does it go? Nobody knows. How much does it get absorbed? Nobody knows. But people have sort of this anecdotal evidence that has built into these commercial products that, okay, it's good for cold and flu. But actually, for the first time, I think what we are seeing is that we can study the mitochondria and immune cells. We know that urolithin A impacts on stemness of immune cells and in this population of memory cells that actually have a very big self-renewing capacity. And we can actually see immune responses happening in real time and how it's getting better over time. And so we are bringing this sort of really deep biotech approach to dissecting benefits of a longevity nutrient like urolithin A and MitoPure on the immune system. And I think it's kind of going to be path-breaking work. The other trial that I'm very excited about is something we've partnered with two of the leading national institutes in the National Institute of Health in the US. So one is the National Cancer Institute, where we are collaborating with the NCI, which is short for National Cancer Institute, where they are looking at oxidative stress and mitochondrial dysfunction in prostate cancer patients. And so that's where we want to see if taking urolithin A as a preventive approach can have an impact in reducing oxidative stress. And the second study is going to be more on metabolic health, and this is with the National Institute of Aging. So there, we're working with the scientific director at National Institute of Aging, Luigi Ferrucci, and the goal really is to show that we can have an impact on metabolism and sort of glucose responses.
So a lot of questions around, I guess two frequently asked questions, and I'm seeing them on the live chat right now.
Mm-hmm.
So one around dosing. How do we think of dosing,
Mm-hmm.
time of day? What would be your recommendation? What have we seen in clinical studies?
Yeah, so this is a great question. So in our clinical studies, we have looked at doses from 250, 500 milligram, and a gram. Okay. Now, when we did our first in-human study, we saw the best effects happening at 500 milligrams of MitoPure and a gram of MitoPure. Then we went longer, so we did multiple other randomized trials that looked at longer effects of these two doses. And both 500 milligram and a gram have great effects on muscle strength and endurance. Now, where we see even better effect of a gram is on the inflammation aspect. So we see a gram having lower C-reactive protein in the individuals that are supplemented with that dose. So it's really, where you feel your body needs. If you feel fatigued more, if you feel you're suffering from inflammation, I recommend to start with the higher dose, and then you can always either continue or shift to the low 500. But the 500 is the commercial dose, and it has great effects on improving mitochondrial, cellular health, and of course improving muscle strength.
And what time of day? I mean, we typically people take them in the morning. Do they take them in the evening? Will it keep me up at night? I mean, does this work like caffeine? Will it keep me up at night if I'm taking it at night?
Well, so this is in let's say the trial settings, and in all our randomized trial settings, what we have seen or what we have recommended as a protocol is to take it first thing in the morning on a fasted state. So that's what most people stick to. And the two doses that I was mentioning is either 2 pills, which delivers 500, or 4 pills that delivers 1 gram. Now, in real world settings, what I'm hearing is a lot of people split the dose. So they take either 1 pill in the morning and 1 in the afternoon, which is perfectly fine because the sort of after you take the 1 pill, in about 6 to 8 hours, you peak the levels of urolithin A in blood. So once you take MitoPure intake, you'll see them peaking and the levels start going down after about 20 hours to 24 hours. So it's something that fits very well with your daily intake because it's once a day kind of setting. But it's up to you to really decide how to split it. I don't think it's like caffeine. Caffeine is really a very sort of hitting on the makes you very attentive and kind of
this stimulant, right?
Yeah, it's a stimulant, and so I think this is a good energy versus let's say a very stimulating form of energy that you would get from caffeine, and very transient form of energy versus this is more sustained. The way I see urolithin A and MitoPure is that it's impacting the foundation of your cellular health. Now, what that means basically is that your cells are better at absorbing nutrients, they're better at fighting inflammation, and they're, of course, better at recycling all the waste.
Mm-hmm. Okay, super. So maybe 2 questions, one on the supplement side and then also on skin. There's so many longevity supplements out there, so many different molecules and ingredients. How do you think about the space? What do you think is unique about MitoPure? How does it compare versus, for example, an NAD plus, an NR, an NMN, spermidine? I mean, the list goes, metformin, the list goes on and on.
Yeah. Well, so there's the category of what I call the drugs that have been experimented, like metformin, as Federico is mentioning, and rapamycin that have been used, and we know they're safe drugs, and now they're being repositioned in the longevity field to see how they will work. Now, back to where we are playing, which is really taking this as a nutritional approach, part of your daily habit. What we are seeing actually is that this is a very unique molecule because it acts at removing the cellular waste inside a cell, and this is the process that we call mitophagy, which is basically self-renewal of the cleaning the garbage disposal. Think of it like your garbage disposal.
Another analogy I heard recently, which I love, was the Pac-Man. It's like your cellular Pac-Man.
Well, when we first published our first paper, the editors at Science actually wrote a small commentary, and they just said it's the Pac-Man of cellular cleaning, and that's what separates it actually, because an NR or nicotinamide riboside, which is a NAD stimulator, acts by just boosting the growth of healthy new mitochondria. Now, space is limited in a cell, right? It can't work if you don't clean the waste. You can't put more garbage in the clean waste if you're not cleaning it out. Now, think about your garbage bin in your house. And that's exactly what makes MitoPure so unique, is that it cleans the waste out, and those become the building blocks of newer healthy mitochondria. So that's how I see it, this nutrient as really an essential nutrient for good cellular health. Now you can combine it with other nutrients. We've touched upon that before.
Okay. So on the skin side, I mean, how would this compare versus a retinol, for example?
Good question. So on the skin aging, it's important to remember that Skin aging is of two types, okay? There's intrinsic aging, and then there's extrinsic aging. Intrinsic aging is the cellular decrease in energy of the skin cells, and that's what we know we can correct very well with MitoPure. Retinol also acts similarly, that it can boost collagen synthesis and can have an impact on lowering wrinkles, for example. MitoPure does it at the same level. Now, the key element is extrinsic aging. So this is the harmful exposure of your skin to harmful UV rays, to pollution, and that is about a 60-70% contributor to accelerated skin aging. That's where MitoPure works much better than retinol. So what it does is that it actually is an anti-inflammatory, as I was mentioning. So it actually reduces the damage created by this harmful UV rays, and that the combined effect is greatly accelerated. Now, the safety profile of retinol is also something to keep in mind, right? So retinol, if you put it on and go to the beach, it's not the greatest thing to put on going to the beach, and it's a skin irritant for a lot of people, and a lot of people are sensitive to different retinol, let's say, products out there. We have tested MitoPure topical products on hundreds of participants for safety and different skin types, and it's very safe. It's very sort of hypoallergenic to the skin.
And so you mentioned something interesting, different skin types, maybe across both the supplement and skin. Has it been primarily men in the studies, primarily women? What's sort of the population? What do the different populations look like?
So most of our studies have a very balanced mix in both. Let's say when we do what we call a randomized clinical trial, you take the age of a person, you take the gender of a person, you take the weight of a person, and you try to what we call balance it out between the placebo group and the MitoPure group. And we have had mostly in a lot of our muscle studies and the nutrition studies, almost 60% are women and 40% are men. Of course, the most recent trial we did with elite athletes, all Olympians, that was the first trial where we mostly focused on male runners. Now on the skin randomized trials, it's again a very healthy mix of men and women, with again women being about 60-70%. So we have a very good balance of men and women in all our trials, except the one I was telling you about.
And on the skin side of things,
yeah,
we've got 3 different products. Do people need to use all 3 of these? Is there a recommendation there? So what do the clinical studies say in terms of which is your favorite?
No, I have no favorites. I have tested individually all of them in randomized trials, and the way you do these trials is you go to one of the top dermatology research groups in the world, and you basically blind them, and they apply a placebo cream on one side of the face of the participant and the active cream on the other. So you've actually tested the day cream, the night cream, and the serum independently of each other. They all have the same dose of MitoPure, so that's the key hero of these products. They all have what we've seen in these trials is they significantly lower wrinkle levels after 8 weeks of application, and what we see is better hydration in the skin, in the face. So I don't have personal favorites. I think it's really whatever suits with people's sort of daily regimen of applying skin products, whether you want it to the day cream or the night cream. And a lot of people prefer a regimen, and that's why we launched these 3 products. Now, it's important as a last point to mention, these products don't just have MitoPure. We've carefully tested and thought a lot about really the top actives that can actually amplify the effect of MitoPure. And so we have niacinamide, which is an NAD booster actually. So we've actually gone in and you create this mitophagy, and then you boost the skin cells energy even more. And so these are carefully crafted products. Some of them have different actives that bring different attributes to the table.
Okay, super.
Yeah.
Last question on skin, and then we'll go back to the live chat. So once skin has begun to thin with age, is there any way that the process of thinning can be slowed? I mean, do you see us reversing aging? Do you see a slowing aging? How do you think of those different things? And what are your thoughts on biological age as well?
Sure. Yeah. Well, I don't think you can reverse aging completely. I think you can slow aging, and you can have this great effect on human health span, what I call health span, which means when you're 70, 80, you're mobile, you're able to, do your daily tasks and play with your grandkids and do your grocery shopping. That's where I think where we really play in. And your second question was on the biological aging, right? So
There was this big paper this year in Science around biological age clocks. Do they work? Do they
Yeah.
not? Epigenetics, but also now proteins being looked at
Yeah.
for organ-specific biological age.
Yeah. So the key to remember again is biological age is just a summation of a lot of things that are happening at a cellular level, right? And so now the research is happening at a fast speed in this space, but what I see actually happening is that everybody has their own aging clock and their own way of assessing biological age. So we are actually working with the best of the best. We're working with the Buck Institute of Aging on this, and one of the leading companies as well. And we're trying to also tackle how MitoPure can impact biological age and immune age and other kinds of, what we think we will see is, because we're impacting inflammation, we're impacting mitochondrial health, that we will of course see an impact on biological age, which is
But you correct me if I'm wrong, but you did 3 or 4 different biological age tests, and you got in one you were 30, in one you were
so
you got 4 different results.
This was
4 different results.
Yeah, so that when we were first getting into this space, and I basically ordered the top 3 biological age kits from 3 different vendors, and I wanted to see what they will all tell. I'm 45 years old, by the way, and some said I was my biological age was 32, some said 37, and one said 44. So I was not really sure which one was the right one. And then we started working, of course, with the Buck Institute of Aging, and I think there's now a sort of a global harmonization happening onto what is the right way methodology to look at biological age. There's actually a very interesting paper even on Mediterranean diet that just came out, showing that people on Mediterranean diet actually had higher levels of urolithin A, and as a result, there was a relationship with lowering biological age. So I think this is the kind of studies that need to happen, really bring the deep scientific approach here.
I think the other thing to think about is, what do I do with that number? So say I'm told that I'm 40. Okay, is that good? Is that bad?
Yeah.
What I think is very interesting in this idea of organ-specific biological age,
Yeah.
it seems like more targeted, and you can actually potentially go do something about it.
That's exactly what we are doing, Federico. So we are now working with this company that I told, and of course the Buck Institute of Aging, where we are not just looking at just holistic biological age number that you don't know what it means, but it's actually going to give you your immune age, your muscle age, your metabolic age, and I think that's more relevant, because then where you need to, and again, it's something, a metric that I think will catch on, because as the science grows, people will use it as a metric of, oh, I'm 60 years old, but my cellular health is 45 years old, right? And I think that's a great tool for people to test some of these interventions on their own.
Okay. So a few more questions here on the live chat. So
Yeah.
questions around other potential applications. A question from Larry here. Have we thought about eye health? Question from Diane. Have we looked into coronary artery disease? And I think there was a previous question also around joint health.
Again, brilliant questions. You have to realize research, as I always say, is 2 words, re and search, and it takes a long time. As I said, we took 10 years for us to crack the muscle aging space, and then of course we knew how the compound was working. We cracked skin aging, and now we're trying to crack immune aging, and there's more and more trials that we are running, and of course we are now partnering with really the top labs around the world. And so next up for us is really brain aging and things like heart aging and gut, what happens to the gut. So these trials will kick on somewhere in the next year or so, and happy to share the data. I mean, it's not that the research happens like that, so you need to be patient. But what the data is showing is that the mechanism remains the same, whether it's your neuron cell or your cardiac cell or your muscle cell. The mechanism of action of activating mitophagy via MitoPure is almost laid down as the universal finding. And I think that's key to understand, is that we now know that you can rewire your mitochondria to a more healthy, youthful state.
And so that's a good segue to the next question, which is, I mean, do you think maybe speak a little bit to this feedback we've sometimes received around, well, is this a miracle, right? I mean, you see it, people commenting, when an article comes out, this sounds like the next snake oil. It sounds like the next miracle pill. How can it do all these things? Is it about doing all these things, or is it about the fact that it does one thing really well, but what it does is so foundational that it has all these downstream impacts? What are your thoughts on that?
I think that's well put. So it's not a miracle pill, okay? So it's please keep doing your exercise, please keep eating the right diet. All these other factors that improve mitochondrial health are very essential, and what I call them the other key pillars of now what it does do is it offers this third pillar of maintaining and boosting your cellular health, right? And the way it does is that this previously unexplored mechanism of action of really targeting longevity, it hits on this pathway, and that pathway is so essential to cellular health that by improving sort of the recycling, now you can do so much more in the cell. The cells communicate better, we see that. The mitochondria look in better shape, we see that in our studies. You see lower inflammation, we see that in our studies. We see more energy and more strength, we see that. So I think it's really that foundational pillar and having these really widespread effects that more and more studies will come in the next few years.
Okay, maybe final question. I know we haven't had a chance to answer all questions, folks. We'll make sure we get back to you in a follow-up session or via email. But maybe a couple of words just on safety. We have a question here from Chris around whether this is safe to take during chemotherapy. We had a couple of other safety-related questions. What are your thoughts on the safety profile?
So that's a fantastic question to end sort of the discussion for today. This is a natural molecule. It's very safe. Evolutionary, we've all been eating nuts and berries and pomegranate, and we've had the right gut microbiome. At least our ancestors have had it for a long time. And as we are now, and myself, I always give my example. Growing up in India, I got a lot of exposure to antibiotics that really messed up my gut microbiome. I lost the capacity to produce this molecule. So it's a very safe molecule. We've studied over thousands participants now. These are healthy participants, so that's what I would like to mention. We haven't, of course, studied somebody undergoing chemotherapy, for example, in the setting. But again, it's a natural product. That's what makes it so safe, and it's easy to formulate compared to other natural molecules. That's the other advantage of the molecule. And today, really thousands of customers have been taking it for years, and I think that's the biggest safety profile that we can talk about. So yeah, very safe profile.
Okay. Well, with that, we conclude today's session. Thank you all for taking the time out of your busy schedules, and we'll make sure that we get back to you with open questions. Johnny, I took note of your personal anecdote. Unfortunately, on a public forum, we can't answer personal health-related questions, but we will make sure we get back to you via email. Please send us an email at care@timelinenutrition.com, and we will take that very seriously. So thank you very much. And with that, we conclude today's AMA.
Yeah, have a nice day.
Thank you.